reproductive system, and it is joined with the urinary system. Now, when you look at it closely, right? This is the pubic bone. Hello? This is the what? A pubic bone. This is the fascia, okay? Then this is the pubic bone. Number 2, the other organ that you can see, this is the bladder. This is the what? I don't have a pointer. Can you imagine? Where's my pen? Okay. So this is the bladder. So when you're catheterizing, this is the what? The urethra. Are we together? Yes. This is the urethra. When you're catheterizing, it will come, the catheter will be here, isn't it? It will be inserted here. So this is the pubic bone, this is the bladder. Now, when you go to the other aspect here, okay? When you go to the other aspect, this is now the vagina, opening the birth canal. Okay, midwifery, they will tell you to say this is the birth canal. So when you look at this, this is the what? The vagina. Then on top there, on top, this is where you're going to find now the uterus. It's a side view. This is the what? The uterus. Then there is this part here. There is this small part here. Okay, there is this small part. And this small part is called what? Who can tell me? The one which reserves the semen. It can only reserve semen for less than 2 hours. After 2 hours, the semen will, the sperm cell will die. Because of the acidic medium of the vagina here. So we call it a phonix, eh? Phonix. We call it a phonix. It reserves the semen. There is also a phonix which is found in the brain, eh? And the phonix which is found in the brain is for memory transmission, eh? Yes, that's why you are able to remember, to say, because it is just nearer to the hippocampus, and you are able to remember episodic memory, where you start now remembering things that happened in episodes, eh? But we have another phonix in the female reproductive system, which now stores what? The sperm cells, eh? Then from there, you are going to find that when you come to this part, okay, when you come to this part, this, the red one you are seeing here, the red one you are seeing, this is an opening of the clitoris, eh? And this is how far a clitoris can go. Are we together? This is the clitoris. So now the clitoris, when you get this, the clitoris, it's here. Are we together? Yes, the clitoris is here. But it can even go deep. Are we together? Then here we are going to find the what? The urethra. Okay? Then this is the vagina what? Opening. Then these you are seeing, these are the labia what? Majora. Then these are what? The labia what? Minora. During puberty stage, you will find that the labia majora is covered by what? The hair cells, right? That's why you will find the hair cells. But now, when everything here, the labia majora, the clitoris, and I don't know why people are smiling.
Why is smiling?
Eh? Why is smiling? Okay, so everything. Okay, then down here we have the what? The anal region. Are we together? This is the anal region. Now the bladder is up. Okay, this is the reason why even in pregnant women, when the baby is now growing in the womb, that you are going to find that as the baby starts pressing on the what? On the uterus, or the baby starts now pressing on the bladder, each and every time you will see a pregnant woman going what? To the bathroom. So now when you are nursing those pregnant women in the ward, what do? We need to catheterize them so that they are not moving up and down, because you might not know what will happen when they go to the what? To the bathroom. Everything should be done from there. Are we together? So now when you are catheterizing, there are a lot of indications we can... do you have the indications there in the procedure manual? For female catheterization? What are those indications? I would love someone to help me so that this can go that side. indications of catheterization, or maybe someone knows the indications? Because we've talked, we have even discussed about them. Yes?
There is urine retention.
Urine retention, right? There is now urine retention where the urine cannot leave the bladder. The urine is now being kept in the what? In the bladder, isn't it? So there is urine retention, right? Yes, what else?
Prolonged urine incontinence.
Prolonged urine incontinence, where just for a person now to just for a person to urinate, you will find that it's difficult, isn't it? So there is that incontinence where the urine cannot what? Come out, isn't it? So what do? We need to help the patient. What else? For surgery?
Pelvic surgery.
Pelvic surgery. So it's not only pelvic surgery, but we can also say any patient who is going for surgery is supposed to be catheterized. Are we together? Yes. Because even during surgery, you are going to cannulate the patient, and the patient will be receiving what? Fluids. So what do? We need to catheterize, because every after urine is formed, urine needs to be what? Excreted, isn't it? And when urine is excreted, what are we saying? We are saying even the toxic substances, even drugs, okay, or the side effects, maybe the toxic substances that are there has to do what? To come out through the what? The urine. Are we together? Yes. So now maybe we can go direct to the procedure, because this one is just similar to male catheterization. The only thing that will be different there is that the positioning and the centimeters for us to catheterize this particular patient. Okay. And the next thing that we need, maybe we can go to the planning. What do we need on top? On the top shelf?
We need 2 sterile receivers.
2 sterile receivers, yes. We have 2 sterile receivers.
2 sterile dripping towels.
2 sterile dripping towels. Let's have 3.
1 towel for drying hands.
The towel for drying hands. We have
5 gallipots.
5 gallipots. One is for what? Cotton. The other one for gauze. The other one for what? Solution. The other one is for what? Can I have the KY jelly from there?
And for lubricants.
For lubricants, right? Yes. Then what else do we need?
On the bottom shelf.
Yes, on the bottom shelf.
We need a Macintosh.
We need the Macintosh. What else?
Receiver for used swabs.
Receiver for used swabs.
Receiver for used instruments.
Then we have receiver for used instruments.
Normal saline.
We have normal saline.
Specimen bottle.
Specimen bottles. So specimen bottles is one now if we need to take the urine for laboratory checkups, right? What else?
The urinary bag.
The urinary bag we have.
Catheter.
Catheter, yes, we have the catheter.
Syringe and needle.
Syringe and needles.
2 pairs of gloves.
2 pairs of gloves.
Water for injection.
Water for injection.
Measuring jug.
The measuring jug.
Fluid balance chart and KY jelly.
Okay, so the fluid balance chart and the KY jelly. Do we know the fluid balance chart? So it's the chart which we use when the patient urinates, isn't it? No wonder we even have the jug, so that we can measure the amount of urine we are going to get from that particular patient for the first time. So if you find that this is the first time you are attending to this particular patient, and you are attending to this particular patient for the first time, you need to check first the urine output that you are going to get or you are going to collect. Then that one will become now as the first data of what? The urine output, so that you can now start comparing how are the kidneys working. Are we together? If you are transfusing some, you are infusing some maybe normal saline or Ringer's lactate, it is going to help you. We have given 2 liters of urine to this particular patient in 2 hours. How much do we need? How much do we get now from this particular patient? So it is going to help you. No wonder we need the measuring jug. That measuring jug is for us to measure. Are we together? But when you look at the urine bag, you can also use it to measure. If you don't have the measuring, you can just measure it from there, because it is well calibrated. But the fact is that if you are using the measuring jug, you can get the correct readings. Are we together? Yes. So now we can go direct to the procedure. So what is the name of the patient?
Yes.
It's a miss now. Hmm? Esther? Do you have Esther here? We don't have any Esther. Ah, Miss James. Okay. So now, in everything you're doing, you need to have the aspect of health assessment. Hello? We need to have the aspect of health assessment because this particular patient is suffering from something that has to do with the urinary system. And you need to have that aspect of urinary system, examination of the urinary system, so that as you are examining the patient, you can even see where the problem is. Are we together? Not only the aspect of urinary system, because that is the main aspect, but you also need the aspect of the general health assessment, the neurological aspect. How is the patient responding? Is the patient drowsy? The patient is not drowsy. Is the patient going to cooperate? And you also need to get the history. Are we together? The history, you will find that if it is the first time you have seen this particular patient, you are going to get the history. But if the patient has been seen by doctors or clinicians or medicalizations, you are going to find that you are going to have the history of the patient or the patient is found. Everything, even the drugs the patient is taking. And you as a clinical nurse, you need to understand whatever the patient is receiving. Are we together? So this is the chart which I'm going to be using. And who is going to be the in charge, isn't it? Okay. So this is Miss James, and you'll be the in charge. The assistant, you are the assistant, right? Okay, so you can just wash your hands in advance. Wash your hands in advance, then no, you can wash your hands in advance, please. Because even me, I'll wash the hands using the same. But at the moment, I'll use this one. Okay. Good morning, madam. I'm student Munya from Sam University, and I've been assigned to catheterize Miss James, who is on bed number 5. She needs to be catheterized and she's due. Is it okay that I can go ahead? Thank you so much. Okay. So I wash my hands. Who's going to be responding as Miss James? Anyone? Can you respond? Good morning, Miss James. Okay, I'm student Mwenya from Rusang University. It have been assigned to do a procedure which is very important on your aspect, looking at your condition that you need to be catheterized. This procedure is going to help you to remove the urine, which is not now, which is still in the bladder, and we have seen that the urine output is not okay. So we need now to remove the excess urine so that we can now prevent you from having other complications of the bladder or the kidney. Okay, so this procedure is supposed to be carried out now, and I'm asking if we can go ahead with the procedure. Before you give me the consent, don't worry, we are going to screen for privacy so that no one can see whatever we are doing. Is it okay I can go ahead with the procedure? Okay, so I'll be back so that I can just assess where you are sleeping and see if you need anything from us. Okay, thank you so much. So the next thing that I'm going to do is to now wash my hands, right? I'll wash my hands so that now I can assess. So this is the second step where we are saying is now patient what? Patient assessment and what? Preparation, isn't it? Okay, so during assessment, there are 4 techniques you can use, isn't it? So we have the first technique, which is the inspection, right? I am going to inspect how the patient is looking like, isn't it? The other way I can inspect is using the what? The nose, isn't it? The smell, isn't it? You can even tell to say maybe the patient has done the business on the bed, isn't it? So you can tell just from smelling if the smelling is not okay. So when you're inspecting, you don't don in gloves. Are we together? We can only don in gloves if you want to palpate or you want to check, isn't it? Okay, so now, after inspecting that the patient is responding well and the patient is okay, we can now go direct now to our business. Okay, so the first thing is to uncover. Now you are going to find that probably that particular patient, the patient is confined, isn't it? So you will check where the patient is sleeping, right? You also check if there is maybe some drops of urine, if there was a catheter, right? If there is the catheter. Now, if you find the patient is closed in the hospital gown, you can just expose a little bit, okay? So that you can now inspect what you want to inspect. Now, what you want to inspect is the female reproductive, isn't it? Okay? So you need to check so that you can know how many swabs do I need to clean now the vulva. Are we together? So now when you inspect, you will find that even the hygiene is not well maintained for this particular patient. The reason why we inspect is to see, because I will catheterize, what is finding that the patient hasn't been following the hygienic measures. You'll find maybe the symphysis pubis is what? Is dirty. You know what I mean? We are talking about shaving the what? This region. So if you find that the patient hasn't done that, you get the consent so that you can clean. You cannot catheterize the vulva which is dead, because that one becomes the source of infection. Are we together? So the reason why we are inspecting is to see, is the vulva clean? Yes or no, it is clean, you can go ahead. If the vulva is not clean, what do? You change the procedure first. Instead of catheterizing, you do what? You shave. Are we together? Yes. If they can allow you, according to their customs and maybe the cultural beliefs, you can call their relatives to come and do what? Do the business, so that you can do what? You can catheterize. Are we together? Yes. Okay, so having seen that the vulva is clean, I will now get the what? The Macintosh. Now, remember, when you're making the bed, you'll find that there's what? The draw sheet and the what? But you still need to put yours, because this one is for the patient. Then you need to put yours for that, for the patient now, okay? So get the Macintosh. Assistant, you can get some gloves. Big pictures. Okay, so Miss James, we are going to expose you a bit so that we can just put this Macintosh. Okay. So the other way you can put the Macintosh, is to position the patient in what? Dorsal, okay? When you position the patient in dorsal, then you just help them to lift the what? Their buttocks there, okay? So we need to put now the draw sheet so that we can cover the patient. Now, looking at this patient we have, positioning the patient in dorsal, it will not help us. If we are the normal patient, it can be okay. Yes. Okay. So now, you tell the patient to say, when I come back to catheterize, we are going to position you in this position, which is now the what? The dorsal. Are we together? Yes. So we'll position them. We need dorsal recumbent like this, so that we can now catheterize them. The reason why we are positioning them in this position is because we want to have the view of what? The vulva. Are we together? So that when you see the vulva, it will be easy for you to clean. But in a male patient, we don't position them in this position, isn't it? Yes. Okay. So now, we have prepared the patient. Can we cover the patient? So you assure them for the privacy, you assure them for whatever you want to do, and leave them in what? Comfortable position, because as we are going to prepare this, it will take time, isn't it? So now, at this point, I need to remove the gloves and tell the patient that I'll be back. So the next thing, what is the next step now? Preparation of the throat, isn't it? Yes. So I will need the assistant to help me. So now, let's do this. We go with this, that side. Let's hope we'll not cross the eyes, okay? So we need to prepare. The first things that I can prepare, strappings, so that we can secure the what? The urinary bag, isn't it? Mm-hmm. Okay, so we need the strapping. when you look at the urinary bag you have, it has no those ropes so that you can tie it the bed, so you need to support it either with the strapping. Okay. Let's get KY jelly. So this is KY jelly, and it is expiring 2025 April. So it is potent for what? For use. I'll go around. Okay. So one guide pot. Please, when you're doing the procedure, you're not supposed to talk. Do we have KY jelly? Can you get someone sanitizer? So this is KY jelly. Hand sanitizer. There's nothing. Okay. Okay, now at this point, I need the assistant to assist me. Okay, so I will tell the assistant. Okay, so assistant, can you get, we can get the first one, the first thing that we are going to get is the catheter. So the assistant can get the catheter. You can open, you can away from it. Okay, you read, you can just do it like this. The other side, no, the other side. Turn it side. The other side. I want to read what is there. Okay, so it is expiring. When is it expiring? So it is expiring 2025 April. It is potent for use. You can open it. So there are two cheater forceps here. I'll get one. Open it, open it. Away from it, don't open it, away from it. Okay? Then when I get it like this, I need to read that we need, this one needs 30 mils of water, and the size is 20 fra, so you can use this one. So you can get now three syringes that are 10 cc. You can open. So you need to read whatever is there, isn't it? The expiring date, open from this side. Is it potent for you? Another one. But you need also open these things on your own so that you can kill time, because you only have 5 minutes. You are supposed to open it from the other side. Okay. Okay, the next thing, what do we need the next? Gloves, right? Gloves, can you open the gloves for me? A pair of sterile gloves. Tear to be done, tear. But you're supposed to open it from there, right? Are these gloves? Let's hope they will not give us stress, eh? Okay. What do we need to open? Yes. So what else do we need to open? So the assistant is the one who is going to open the what? The urinary bag, okay? So at this point, I can also get now the normal saline which we are going to use. Are we together? So the assistant can move a little bit so that I can open now. I can get now the normal saline. Okay? We said one gun pot should have what? So you will read, isn't it? The expiring date and the solution you are using. Away from the label, sorry. Away from the label. When you look at this, are we done with the preparation? Everything we need? We don't need the urinary bag on top. Yes, so we are done, isn't it? Okay, the next thing is to do what? To scrub. Okay? So you can, it's right there. Okay. At this point, and I said these gloves will give us stress. But please don't talk when you're doing this procedure. So the next thing is to start now preparing the swabs. Okay? The swabs I'm going to use. Now, when you look at when you have checked how many swabs you need, okay? You check first. If you see how clean the valve is, it will direct you to the number of swabs you're supposed to use. So for example, the standardized one, they say you need to prepare at least 5 to 6 swabs. But when you are doing it on a real patient, you know that is now the patient, so you need to prepare even 7 swabs. You make sure that everything is what? Clean, isn't it? Okay. The next thing that we forgot is now the fluid that we are supposed to use. Are we together? The fluid that we are supposed to, we said the water for what? For injection, right? Yes, water for injection. So now what we are going to do, since you can get the bottle, then we use one of the galley pot. Then when you are opening this, you look at this, okay? You will see the opening here, okay? You will see the opening like here, okay? You are not supposed to start opening from here. You open from here. It will come clear like that, okay? Then, so for you pour from here, you read what is there and you pour. So we know this is the water for injection. You can just pour from there. So now, when you are preparing the catheter, 2.5 centimeters to 5 centimeters. That's how you are going to put your KY jelly. Are we together? Then you put it in the receiver like that. Now we need to prepare the water. So now, even when you are preparing the water, please, you make sure that it goes like that. Like that. Okay. The next thing is to go nearer to who? Okay. So, Miss James, I'm back to catheterize you. I'll ask the assistant to expose you so that we can now position you in the correct position for catheterization. Okay. Your hands are not supposed to be like this, but they are supposed to be like this. Okay. So you can position the patient, please. But avoid overchilling the patient, right? Because you have looked at the vital signs. If the patient is hypothermic, do not overexpose them, isn't it? And even to some extent, even you, suppose you are exposed like this, you will feel uncomfortable, isn't it? So you can just leave it the way it is like that. So the first thing that I'm going to do is to drape the patient, okay? So I'll get this. So now we'll start from what? The furthest, isn't it? Okay? So it goes like that. Like that. We get another one, like that. Then we cover this pattern, like that. Then we get the last one. We are going to cover this part. Are we together? Yes. Okay. The next thing that I'm going to do is to do what? To swab the patient. Are we together? So now at this point, I need to divide what will be going to the patient and what will be going to the trolley. Okay, so I can get this one. I pass it like that. So now, before we start, okay, maybe you can pass this side. Before we start, because when you look at the valve there, when you look at the valve, I need to support it so that I can clean well. Don't be too near to the patient. Eh? Okay, so I'll pass this one like that. I put it on top. Then I get this swab, the first swab, like that. So I'll go to this part. This hand is sterile, this is sterile. So I'll start with what? The furthest, rabia what? Majora. I go down like that. I throw it. Then I get another one. I go like that. The nearest what? Majora, like that. Okay. I throw it. I get another one. Then what I need to clean is what? The inside, isn't it? Because the inside, that's why we are going to find the what? The minora, isn't it? So I'll get now the minora. Now I need to support by opening. Hello? In essence, there are no insults, please. By opening like that, I throw it, I get another one, I go there, the nearest, rubber minora. Then at this point, I need now to start cleaning from the uppermost here, okay? From the uppermost, then I need to support it by cleaning like that. Then I go up to where? The perineum. Are we together? I'm starting from this part where the clitoris is, on top there, but do not stimulate the clitoris, please. Eh? You go there, then it goes, you clean also the vagina, then up to the what? The perineum area. Then that's when now you do what? This one has been used, isn't it? You have used it. So you can even what? Discard it. You get another one, you put it on top there, okay? Now, at this point we need to do what? To catheterize, isn't it? So what do we do? So what do we do? We need to bring this, isn't it? We need to bring this so that it is, you can place it on top there. It's okay. You can place it on top there because we need now to catheterize, isn't it? Then the next thing that you can also bring closer is the water that you want to. So the water you can put it down there. Are we together? Then, because you need to catheterize, this one is what? Sterile, isn't it? Okay. So you can place it on top there. You can place, because even this plastic is sterile, then this can go where? Down there. Are we together? Yes. Okay, it can go down there. Then I hold this, okay? Then I support like that. Then this one should go now in the receiver, so that now I just open. I'm just opening and support there. This is where the urethra. Please, never should you catheterize the vagina. We catheterize through the what? Now, in female patients, you find that the urethra is what? Is not that much long. So 4 to 8 centimeters. And now you assure the patient, because the patient will feel that sensation, and the patient might be feeling some painful sensation. So you assure them that you will be done. Okay, so now when you are in the bladder, you do what? You will see now the what? The urine coming. So when you see the urine coming, add 2 to 3 centimeters. Okay, you add 2 to 3 centimeters. And what do? You remove the what? The plastic. Okay, you remove the plastic. At this point, sterilization is what? Okay, so you can get now this one. Okay, then you support like that, because we are saying it's 30 mils, right? So it will go in. As we are pushing in, you can tell the assistant to do what? To prepare what? The urinary bag. The assistant to prepare the urinary bag. If you are doing, if this procedure is there in OSCE, the next thing that you should be doing as you are pushing in the distilled water, please don't push in the normal saline. Okay, yes. You can even be given IAC. What type of IAC are we going to give this patient?
Don't move down.
So you are opening from this side, not from that side, okay? You are supposed to read what is there and everything, the expiring date. Can you be quick? Be quick, be quick. Come this side.
The expiring date is August 2026.
So it is potent for use, right?
Yes.
So you tear from there, tear on top. Is that where you are supposed to tear it? Read what is there. Where are you supposed to tear it from? Yes. Yes, you open from there. So I can use this hand and do what? Remember, the urine is what? In the what? In the receiver, isn't it? But you don't have to discard that urine. So you just now cap it like that. And the urine will continue now being in what? In the receiver. So what do you do? The next thing, you get strapping. This is the leg, isn't it? So you can now position the patient. These things can be removed. Okay? Can be removed. The urine, don't throw the same urine. Okay? Can be removed. You position the patient. And when you position the patient, you get now strapping. And do like that. Now when you look at this urine bag, it has no look, so you can even tie it. You can now position it there. This urine bag is not supposed to be down. Are we together? Yes. Okay. You discard everything. You remove this, cover the patient, thank the patient for cooperation. And now the urine which is there, you need to what? To measure the urine so that you have the baseline data of the urine output. Okay? You need to fold this, give IAC. What type of IAC are we going to give this particular patient? Hygienic measures, don't touch, and other things, the nutrition content, and depending on the condition the patient is suffering from, you need also to talk about those things. Cover the patient. Where is the assistant?